If you break your arm, an X-ray gives you a really clean binary answer. It's either broken or it's not broken.
Right, you're looking for this very clear structural failure on the scan.
Exactly. But if you step into the world of women's health, and specifically the pelvic floor, that X-ray machine it's completely useless.
Oh, totally useless.
Mm.
Because that structural failure just isn't there in the same way.
Yeah, and today we're looking at a symptom that leaves countless women feeling completely isolated. We're answering a question that really rarely gets asked out loud.
Which is so unfortunate because the diagnostic landscape for pelvic health is just notoriously murky.
Right.
Especially when the symptoms seem to shift from, week to week.
Which leaves people feeling like they're literally losing their minds. So welcome to this custom-tailored deep dive designed specifically for you. We have a really fascinating mission today.
We really do.
We are pulling together clinical medical reviews, insights from leading physiotherapy practices, and all of this current physiological research to answer this one specific question. Can premenstrual estrogen changes actually make vaginal looseness or, pelvic heaviness feel worse?
It's a question that bridges this massive gap, really. Yeah, because we are connecting what you physically feel happening in your body to the really complex invisible chemical signals that are basically running the show behind the scenes.
Okay, let's unpack this, because if you ever felt like your pelvic floor symptoms just inexplicably flare up right before your period.
Which happens to so many people.
Right. If you suddenly feel heavier or you're leaking a bit more or things just feel totally unsupportive, I want to assure you right now, it is absolutely not in your head.
No, not at all.
It's biology. It is actively happening. But before we get into the hormones, we actually have to clear the air about the word loose.
We really do. We need to redefine what looseness actually means anatomically, and honestly, we need to toss out some very outdated, very damaging myths.
Yeah, like the whole idea of a permanently loose vagina from, say, having multiple partners. That is entirely fiction.
Completely.
It's a cultural myth. It's not a medical reality at all.
Historically, that concept has been used almost exclusively to just shame women. But the actual anatomical reality is that the vaginal canal is highly, highly elastic.
Right, it's made to stretch.
Exactly. The tissues are literally designed to stretch to accommodate things coming in or going out, like, delivering an entire baby, and then return to their baseline shape.
Which is incredible when you think about it.
It is. And the truth is, the only things that genuinely alter your baseline vaginal elasticity over the long term are age specifically, the permanent drop in estrogen as you approach menopause, and the physical trauma of childbirth.
Okay, so if the vagina itself is that highly elastic and it just naturally bounces back, what is a person actually feeling when they describe a sensation of looseness or heaviness, say, in their mid-20s or 30s?
Well, what we are actually talking about here is vaginal laxity and pelvic floor dysfunction.
Okay.
It's crucial to visualize this correctly because the pelvic floor is not just this static hammock of muscle that you sit on.
Right, it's not just hanging there.
No, it's a highly dynamic pressure system. It's made up of muscles, ligaments, and dense connective tissues called fascia.
Fascia, right.
And this system is actively working all day long to support your bladder, your bowel, and your uterus against gravity. Plus, it's fighting against the internal pressure of your own abdomen.
So instead of thinking of the pelvic floor like a hammock that just, stretches out and breaks under weight, we should think of it more like a trampoline that responds to the weather.
I love that analogy.
Yes.
And to take that trampoline analogy a step further, the springs and the mat don't just react to the weight of whoever is jumping on them.
Right.
The tension of the materials actually reacts to the environment. In this analogy, the weather that constantly changes the tension of your internal trampoline is your menstrual cycle.
The hormones.
Exactly. Specifically, the fluctuating levels of estrogen, progesterone, and a hormone called relaxin.
So if hormones are the weather affecting this trampoline, what is happening in that specific window right before a period? Because looking at the clinical data, that seems to be when everyone just feels the worst.
Yeah.
Like the whole system just seems to go offline.
To understand that, we really have to look at the luteal phase.
Okay, remind me what that is exactly.
That's the second half of your menstrual cycle. It starts right after you ovulate and lasts until your period actually begins.
Got it.
During this time, the follicle that just released an egg transforms into this temporary endocrine gland called the corpus luteum.
Wow, okay.
And this gland is a massive hormone factory. Its entire job is to prepare your uterus for a potential pregnancy.
So the body is basically assuming, hey, we might have a fertilized egg coming down the pike. Let's renovate the house and get ready.
Exactly. And the primary hormone it pumps out to do this renovation is progesterone. But right before your period, if a fertilized egg doesn't implant, this whole system basically just packs up and goes home.
The renovation is canceled.
Yes. You experience a really dramatic hormonal crash. Both progesterone and estrogen plummet rapidly.
Oh, wow.
And that sudden withdrawal of hormones is actually what triggers the shedding of the uterine lining, which is your period.
Wait, so if the whole system crashes, what is happening to the actual tissue in the pelvic floor? Because I know estrogen keeps, like, facial skin plump and youthful. Is it doing the same thing internally?
It is doing exactly that, but on a much more structurally critical level.
Oh, really?
Yeah, estrogen is essentially the architect of your pelvic floor's integrity. It's a vasodilator, which means it promotes really healthy blood flow to the area.
Okay, that makes sense.
But more importantly, it signals these cells called fibroblasts to produce collagen. Estrogen literally maintains the tissue thickness, the plumpness, and the elastic stretch of the vaginal wall and all those surrounding ligaments.
So when estrogen levels just drop off a cliff right before your period, the structural architect basically leaves the building.
Completely leaves the building. The supportive tissues literally become less robust because the high levels of estrogen aren't there to maintain that plump, hydrated quality anymore.
So they dry out.
In a sense, yes. The tissues become stiffer, they're less flexible, and they get highly sensitive. You temporarily lose that structural bounce in the trampoline mat.
Man, that's brutal. And while estrogen is taking away the bounce, progesterone is doing its own thing, right? You mentioned progesterone peaks in this luteal phase to prepare the uterus, but how does a hormone that's meant for the uterus mess with the pelvic floor?
Well, progesterone's main physiological job is to soften tissues and relax smooth muscle.
Okay.
It does this to keep the uterus from contracting and, rejecting a potential embryo.
That's pretty smart of the body.
It is, but hormones don't just stay in one place. They act systemically.
Oh,
Progesterone affects smooth muscle throughout your entire body, and your digestive tract is essentially just one long tube of smooth muscle.
Ah, I see where this is going. So it slows down the contractions in the gut. The transit time basically grinds to a halt.
Exactly, which very often leads to premenstrual constipation.
Ugh, the worst.
And here is where the mechanical pressure system comes back into play. If your digestive tract is backed up, you are directly increasing your intra-abdominal pressure.
Because there's physically more in there.
Yes. You now have a heavier, fuller bowel physically pushing down from above on a pelvic floor that has just lost its estrogen support from below.
That is such a brutal mechanical combination. You have this heavy pressure pushing down on a stiff, unsupported mat.
Right.
But then we have to introduce a third hormone into this mix, and this one really threw me. Yeah. Relaxin.
Yes, relaxin.
We usually only hear about relaxin during late-stage pregnancy, right? Like loosening the pelvis to physically fit a baby out.
We do usually associate it with birth, yeah. But recent clinical reviews reveal that relaxin is actually produced every single month during the luteal phase.
Wait, really? Every month?
Every month, whether you are pregnant or not. It cycles right alongside estrogen and progesterone, peaking in those exact same days before your period.
What exactly does relaxin do on a chemical level? Like, how does it actually relax a ligament?
On a molecular level, relaxin activates these specific enzymes called matrix metalloproteinases, or MMPs. Specifically, they're collagenases and gelatinases.
Okay, that's a lot of science words. What do they do?
Think of MMPs like microscopic chemical scissors.
Oh, I like that. Chemical scissors.
Right. When relaxin activates them, these enzymes are deployed to literally snip away at rigid collagen fibers. They locally unweave the tight structural net of your ligaments so they become looser and more pliable. And research shows that women have really dense relaxin receptors in multiple joints, but especially throughout the pelvis.
Wait, let me get this straight. Relaxin is deploying chemical scissors to actively break down collagen and loosen ligaments right when estrogen is dropping and removing our tissue elasticity.
Yes, exactly.
Isn't that totally counterproductive if you aren't actually pregnant? I mean, you're just dismantling the pelvic floor's support system for absolutely no reason.
What's fascinating here is that biology doesn't view it as counterproductive at all.
It doesn't.
No, biology has a one-track mind. The body is simply preparing for a potential pregnancy every single month, without fail.
Huh.
It is completely prioritizing making physical room for an embryo and eventually a growing baby entirely over your day-to-day pelvic floor comfort. The human system is designed for reproduction first and optimal biomechanical stability second.
That is mind-blowing. So just to recap, we have estrogen dropping, which makes the tissues stiff and less supportive. We have progesterone peaking, which causes constipation and pushes a heavy weight down on the system. And we have relaxin actively chewing up collagen to loosen the structural ligaments holding it all together.
It is the absolute definition of a hormonal perfect storm.
The chemistry makes total sense now, but how does this cascade actually translate to the physical symptoms you experience in your body? Because reading the case studies from the physios, the symptoms women describe in this window are, like, incredibly specific.
Oh, they are. When you combine the stiffening of tissues, the increased downward pressure from the bowel, and the active ligament laxity, the physical realities just become undeniable.
Give me an example.
Well, for instance, clinical research shows that up to 41% of women report cyclical changes in urinary incontinence.
41%.
Almost half. You might find you're leaking a little urine when you cough, sneeze, or lift something heavy, but only in those 5 to 7 days leading up to your period.
What about that heavy dragging feeling people describe? Like it feels like your insides are literally falling out. There was something in the clinical notes about the cervix changing position.
Yes. During menstruation and the lead up to it, the cervix actually softens and sits lower in the vaginal canal. It physically descends.
Oh, wow. So it is actually dropping.
It is. For women dealing with existing uterine prolapse or even just mild everyday laxity, this creates a very real sensation of dragging or bulging.
Right.
Medical texts often refer to this symptom as a gaping introitus, which basically just means the patient feels a sense of widening or a lack of closure at the vaginal opening.
So it's not just your imagination or anxiety. The internal anatomy is physically shifting downward.
Precisely.
And I also saw bladder urgency mentioned frequently. Why would you suddenly feel like you have to pee all the time just because your period is coming?
That points right back to our friend progesterone.
Of course it does.
Higher progesterone levels can make the detrusor muscle, which is the muscle that wraps around your bladder, more active and, well, for lack of a better word, twitchy.
Twitchy.
Yeah, so your bladder becomes highly sensitive and reactive even when it isn't actually full, causing that sudden, urgent need to just run to the bathroom.
Here's where it gets really interesting, though. A lot of the pelvic floor experts make a massive point of clarifying what all this actually means for a person's overall progress.
Yes, this is key.
They emphasize that your system is more sensitive, not necessarily weaker. Can you explain the physiological distinction there?
It's probably the most important takeaway from all of this biological complexity. Because of the sudden drop in estrogen, your pelvic floor tissues become temporarily stiffer and just less pliable.
Okay.
They lose their ability to adapt smoothly to sudden pressure and movement. So when you cough or jump or even just stand on your feet for a long time, the pelvic floor simply cannot absorb that kinetic energy and pressure as well as it did, say, 2 weeks ago.
It's like driving a car where the suspension suddenly gets locked into a stiff, rigid setting for a few days.
That's a great way to put it.
You feel every single pothole and bump in the road right in your spine. But the car isn't broken, and you haven't forgotten how to drive or lost your progress. The shock absorption system is just temporarily compromised and extra sensitive to force.
Exactly. Your muscles didn't suddenly atrophy overnight. Your prolapse didn't permanently worsen.
Right.
The internal environment simply changed. The tissues are stiffer from low estrogen, the ligaments are a bit looser from those relaxin scissors, and your nervous system is just on high alert.
So the load is the same, but the buffer is gone.
You're experiencing the exact same mechanical load from daily life, but your body's ability to buffer that load is on a temporary hiatus.
Which is incredibly validating to hear, but I mean, validation is only half the battle. If these symptoms are a predictable, cyclical part of the month, we can actually plan for them, rather than just suffering through the heaviness and the leaking. Let's get into the execution. What are the actionable strategies here?
If we connect this to the bigger picture, knowing your cycle is your greatest physical tool. Physiotherapists outline very specific, evidence-based strategies for that 5 to 7 day window before your period.
Okay, what's step one?
The first most critical strategy is to intentionally deload the system.
Deload, meaning take the pressure off. But how do you actually do that when you still have to, walk around and live your life?
Because these hormonal changes can ramp up your body's sympathetic nervous system, which is your stress response, your pelvic floor might be unconsciously clenching in what therapists call a brace mode.
A brace mode?
Yeah, you're holding tension to guard against that heavy feeling without even realizing it. Physiotherapists recommend specific movements like diaphragmatic breathing, child's pose with wide knees, and supported deep squats.
Let's break down the breathing part. How does just breathing differently stop the pelvic floor from clenching?
Well, your pelvic floor and your respiratory diaphragm actually work together like a piston system.
Like in an engine.
Exactly. When you take a deep, slow, diaphragmatic breath, meaning you're expanding your ribs and your belly instead of just lifting your chest, your diaphragm pushes down.
Okay.
This signals your vagus nerve to switch your nervous system from fight or flight into rest and digest.
Oh, that's huge.
It is. And simultaneously, that downward air pressure physically forces the tight, braced pelvic floor muscles to lengthen and yield. You are actively commanding the system to stand down.
So you're using your breath to manually override the nervous system's panic response to the heaviness.
Yes, precisely.
What about the physical pressure coming from above? How do we handle the whole progesterone constipation issue?
You have to manage the intra-abdominal pressure proactively. You know progesterone is going to act on that smooth muscle and slow your gut down in the luteal phase, so you have to get ahead of it.
Don't wait until it's a problem.
Exactly. Don't wait until you're backed up. Increase your soluble fiber intake gradually starting mid-cycle.
Good tip.
Add a small amount of prune juice daily during the luteal phase to just draw water into the bowel. And stay highly, highly hydrated.
Because the absolute worst thing you can do for a sensitive pelvic floor is bear down and strain, right?
Straining pushes extreme concentrated force directly down on those relaxed and loosened ligaments and the estrogen-deprived tissues.
Oh.
Yeah, it is a recipe for worsening prolapse symptoms. Optimal toileting position is also crucial here. Using a footstool to elevate your knees above your hips straightens out the colon so you don't actually have to push. You just let gravity do the work, minimizing all that internal pressure.
And from a nutritional standpoint, we talked about estrogen building collagen earlier. Since estrogen is dropping, can we, I don't know, eat our way to better collagen support in this window?
You can definitely support the physiological process. You want to give your body the raw materials for tissue repair.
Like what?
That means focusing on foods rich in vitamin C.
Just vitamin C?
Well, vitamin C isn't just for immunity. It is a mandatory cofactor for assembling the collagen triple helix structure. Without it, your body literally cannot weave new collagen.
Oh, wow. I had no idea.
Yeah. You also need adequate protein for the amino acid building blocks and omega-3 fatty acids, which improve local circulation and reduce systemic inflammation.
Okay, I have to ask a question here because I think a lot of people will assume the absolute opposite of what we're discussing. I want to push back on a very, very common instinct.
Sure, go ahead.
If I am in my luteal phase and I am feeling physically loose and heavy and maybe I'm leaking a little bit, maybe I'm leaking a little bit, shouldn't my first instinct be to just do 100 Kegels to tighten everything back up? Like just squeeze the pelvic floor until it's strong again?
It is the most common instinct in the world, and it is almost always the exact wrong move in this specific hormonal scenario.
Wait, really?
The clinical consensus is very clear on this. Doing Kegels when you're experiencing these premenstrual flare-ups can actually exacerbate your symptoms significantly.
How does doing a strengthening exercise make the looseness worse? That seems totally backward.
Think about the physiological state of the pelvic floor during this time. The muscles are likely already in that unconscious brace mode we talked about.
Right, they're already clenching.
They are fatigued, tight, and constantly firing to compensate for the loose ligaments caused by the relaxant. Plus, they are fighting the increased downward pressure from the bowel.
So they're exhausted.
Exactly. When a muscle is constantly clenched, blood flow is restricted, a state called ischemia.
So the muscle is literally suffocating.
It's exhausted and lacks oxygen. If you just blindly squeeze a muscle that is already in a state of exhausted spasm, you aren't strengthening it.
Oh, that makes so much sense.
Right. A muscle needs to fully lengthen before it can contract with any actual power. By doing Kegels now, you are just adding more tension to a rigid system that is desperately crying out for relaxation and blood flow.
So you're just tightening a muscle that's already locked up? You're trying to drive the car with the parking brake on and wondering why it feels so weak and sluggish?
That is the perfect analogy. The focus during this premenstrual window must be on relaxation, mobility, and pressure management, not blindly tightening.
Okay, that's a huge shift in perspective.
It is. If your pelvic floor is compensating and you force it into more tension with Kegels, you will likely just increase your pelvic pain and make the feeling of heaviness and prolapse much more pronounced. You have to let the muscles yield and recover.
So what does this all mean? Let's bring this all together for everyone listening. If you've been listening to this and nodding your head because every single month you feel like your pelvic floor is completely giving out on you, I want to validate your experience right now.
Absolutely.
The premenstrual sensation of looseness, of leaking, of intense heaviness, it is a real documented biological reality.
It is deeply rooted in your changing physiology. It is not a lack of effort, and it's not a permanent failure of your body.
It is the direct mechanical result of the drop in estrogen making your tissues stiffer, the rise in progesterone causing smooth muscle constipation and bladder twitchiness, and the chemical scissors of relaxin loosening your structural ligaments.
Exactly.
But the most important thing to walk away with today is that this does not mean your pelvic floor is permanently broken, and it doesn't mean you've lost all your physical progress. Your system is just temporarily adapting to a hostile hormonal environment. It's the car with the stiff suspension.
And because it is a predictable cyclical environment, you can actually anticipate it.
Right, you can plan for it.
You can support your body through it by intentionally deloading the nervous system with breathing, proactively managing bowel pressure, and prioritizing tissue hydration rather than panicking and just punishing the muscles with more tension.
We have covered so much ground today, but before we wrap up, I know you found one final detail in the clinical research that really forces us to look at this whole system from a completely different and honestly slightly unnerving angle.
Yes, I want to leave you with a final thought to explore on your own.
Okay, let's hear it.
Today, we've talked entirely about natural reproductive hormones. You know, the monthly unavoidable ebb and flow of estrogen, progesterone, and relaxin.
Right.
But consider this. Chronic, daily emotional and physical stress causes your adrenal glands to constantly pump out stress hormones like cortisol.
Which we all have way too much of.
Exactly. And that triggers the continuous fight-or-flight response in your body. Over time, research shows this adrenal overdrive actually leads to systemic cellular dehydration, making your muscles chronically dry and tight, while simultaneously causing further ligament laxity throughout the entire body.
Oh, wow. So chronic stress basically mimics and compounds the exact mechanical issues that the reproductive hormones are already causing.
Yes, it raises a really important, provocative question for you to mull over. How much is our modern high-stress lifestyle silently amplifying these natural monthly pelvic floor fluctuations?
That is wild.
Are we blaming our biological cycle for severe symptoms that our daily stress levels are actually pushing over the edge?
That is a fascinating question to leave on. If you're constantly living in fight or flight, your trampoline is already strung way too tight and dried out before the internal weather even changes.
And that changes the entire approach to how we manage our physical health.
Well, that is all the time we have for today's deep dive. Thank you so much for joining us and letting us unpack this stack of research for you. We hope you are walking away a little more well-informed, a little more empowered, and with a much better understanding of the incredible dynamic system that is your own body. Until next time, remember, the diagnostic X-ray machine might be completely useless here, but the biology is brilliant. Take care.